Good afternoon. I'm Congressman Dwight Evans. Thank you for joining me today's town hall meeting. The Medicare open enrollment period through December the 7th. This is a chance to review your benefits in time for 2025 to make sure your plan offers the right coverage for your needs. I want to make a moment to thank everyone who has called, to email, or to wish me as I continue to rehabilitation and recovery following my minor stroke early this year. I want you to know that I'm eager to return to Washington as soon as possible. But first, my medical team has advised me to continue with more rehab and recovery before I resume regular travel to and from Washington, beginning with the swearing in the new Congress on January the 3rd. The goal is to make sure my leg and mobility are in improved conditions to enable my return to full duty. In the meantime, I'm continuing to meet with the constituents of my Northwest Philadelphia office. I'm eager in staying updated and directing this action of my staff. I want to emphasize with all my staff has continued to keep the office open and serving constituents. For this town hall is another way that we are serving the people of Philadelphia. We have 5 experts, guest speakers online today, here to answer questions, some of the questions about Medicaid open enrollment. First, you will get a chance to hear from these experts, and then we will take some of your questions about Medicaid open enrollment. To ask the question, press *3 at any time. If you'd like to sign up to my email newsletter, press *6. Again, to ask a question, press *3. Before we get to the question I want to share some good news. Medicare enrollment will have their out-of-pocket drug costs capped at $2,000 per year starting in January. This is because President Biden's Inflation Reduction Act that I voted for. This law has also created $35 a month cap on the cost of insulin for Medicaid benefits. I want to continue to support extending that insulin cost protection to all Americans. Today, I joined 5 experts to help you understand the Medicare open enrollment. To ask the question, press *3 at any time. And if you'd like to sign up for the email newsletter, press *6. I will now introduce the guest, and we will have my communication director, Ben, who will speak. But Ben, at some point, I will just lightly introduce their names, and they go from there. The first person, the guest speaker, I'd like to Richard. Richard is a public affairs specialist for Social Security Administration. Welcome you, and thank you. So thank you very much, Richard. I'd like to thank Richard. Next time we have 2 experienced from the Center for Medicare and Medicaid Services, Sharon and Monique Scott. Sharon, both of them are also. I'd like to thank them too, and thank them to be available. So first I'd like to have Richard introduce himself. Richard?
Good afternoon, Congressman Evans. Good to hear from you. I hope you're coming along well, as you said, so best of luck. And I just want to say just briefly, our role at Social Security in terms of Medicare is that we are the agency that people go to file their initial claim when they first are getting on Medicare. So people can file online at our website, which is ssa.gov, or they can contact us, call our 800 number, 1-800-772-1213, 1-800-772-1213, and they can set up a phone appointment if they prefer that. So we are the people you start with, and then after that, once a person is on, then generally CMS, the Centers for Medicare and Medicaid Services, the folks that are going to follow me, they would handle your health care issues. So I thank you again, Congressman. Look forward to speaking with your constituents.
Thank you, Richard. Next, we have two speakers with Center for Medicare and Medicaid Service. Sharon?
Hi, good afternoon. Thanks so much, Congressman. Really appreciate the time today to speak with your constituents about Medicare open enrollment. And as you already mentioned, this is now the heart of our Medicare open enrollment season, which started back on October 15th and runs through December 7th. And this is the time of year where we're just encouraging everybody to take some time to review your health care choices and the options that are available to you. Because every single year, the plans that are available to people with Medicare change, and your own health care needs change too. And you may find that you need to make some changes to your health care coverage to meet your current needs. You might have original Medicare, and that's working fine for you. Perhaps you've picked up a Medicare supplement to fill in those out-of-pocket costs that original Medicare has. And if you have original Medicare, you may have also picked up a prescription drug plan, but now's the time to see if that prescription drug plan still meets your needs. Or maybe you've chosen to get your Medicare coverage through a Medicare Advantage plan. This is the time of year where you can look at all of those Medicare Advantage plans that are available to you and decide if your current plan is still meeting your needs, and if not, you can switch to another plan. Because right now in Pennsylvania, there are about 200 plans that are available to people, and so there is going to be an option out there to meet your needs. And I always just like to break it down for people to think about your options by the 3 C's of cost, coverage, and convenience. Look at the out-of-pocket costs, and if it still meets your budget, you want to look at premiums as well as the cost sharing when you go to get services. Are the doctors still convenient for you? Are your drugs still covered on the formulary that those prescription drug plans have, or have those costs changed for you? And are the providers in, say, a Medicare Advantage network ones that are convenient for you to access? So it's really those 3 C's you want to look at: cost, coverage, and convenience. And I know the Congressman has assembled a great team of people here today to answer questions. I just want to make sure that you know about the Medicare resources available to you. Hopefully by now you've all received a Medicare and You handbook that's specific to Pennsylvania and specific to you. I encourage you to, especially if you're looking at Medicare Advantage and prescription drug plans, to look at the appendix in the back where we list all of those local plans that are available for you. But if you still need additional help too, 1-800-MEDICARE is our 24-hour phone line service. We have assistance in over 200 languages at 1-800-MEDICARE. And we also have a great website for our beneficiaries, and that's medicare.gov. So all easy to remember and great resources for you to have at hand. So again, thanks, Congressman, and I look forward to answering questions. I'll turn it back to you.
Okay, I'd like to go to Monique.
Yes, I'm sorry.
Sure,
Monique has joined me. Sorry, Monique.
No problem. Sharon did a great job outlining. We just want to make sure people are aware of those official government resources, again, medicare.gov and 1-800-MEDICARE. And we also want to make sure that people guard their information. So please be careful if you're getting unsolicited calls or contacts that you didn't initiate about sharing your information. The government is not calling to verify your financial information or your Medicare information. So as you're shopping and choosing, please make sure that you're only sharing your personal information, your Medicare information, with those people who need to have it. And that's all for me. Thank you so much.
Thank you, Shannon. Monique. Now, Tom, you, the cleanup time.
Yeah, thank you, Congressman Evans. Tom Sneddon. I'm with the Pennsylvania Department of Aging here in Harrisburg, and we have resources available to people who might need some guidance with respect to picking a plan or choosing a new plan, and that would be our PA Medi benefit, which is Pennsylvania Medicare Education and Decision Insight. The number to call to get help in making decisions on your plan choice would be 800-783-7067. I would also mention another resource that we have here at the department, and that is the PACE program. PACE program is a comprehensive pharmacy benefit for older Pennsylvanians, and it wraps around other coverages like Medicare or Veterans Administration benefits. And if you qualify for PACE. About 3 out of 4 people older than 65 in Pennsylvania qualify. You should be enrolled in that benefit. The number to call to determine whether or not you are eligible is 800-225-7223. And the PACE program would be happy to work with you also in choosing a plan if you're enrolled in the PACE benefit. So 2 very important resources that you can use to make good decisions during this open enrollment period. Thank you, Congressman Evans.
Linda, I know this program well. I was in the legislature for a long time. So, Linda, can you talk about turn it to you?
Absolutely. Thank you, Congressman. I certainly appreciate it, and I'd love to share a little about our wonderful agency, Philadelphia Corporation for Aging, who is focused on serving individuals who are 60 and over in many, many ways. Clearly, we offer a plethora of services that are vital to individuals, such as senior centers, transportation, senior companion programs, employment, PA Betty, which I'd love to share more about our local program, home at health at home, assessments, options, which is a home and community-based program, home delivered meals, home repairs and modifications, and domiciliary care. We provide protection and advocacy through many of our programs. And for general information about services, you can contact PCA at 215-765-9040, 215-765-9040 for help. I'd just like to circle back quickly just to tell you more about the local PA Medi program that, again, is administered for Philadelphians. And I would say that we are a program of staff and volunteers who are developed to help navigate the healthcare system for you, the Medicare healthcare system. So our goal is to navigate, educate, counsel for you, and save money. And the good thing is that it is all free and definitely unbiased. And so you may see a lot of things on television where there's specific salespeople, but the thing about the PA Medi program that is, again, administered through the Pennsylvania Department of Aging, and then funded to the local area agency on aging, PCA, is that our services are free. We are there to answer questions, provide counseling to you, and there is no bias. We're not trying to lead you in any specific way. We're basically geared to answer your questions and help you navigate the system and to hopefully make good decisions with regard to plans and ways to save. Just to share more about the local program contact, we work with 2 community partners, and one is the CARRY program, and they can be reached if you have questions or have counseling needs at 215-545-5728. And for anyone in South, North Central, or West, they can contact and ask for David or Adriana. For those who live in Northwest and Northeast of Philadelphia, they would contact Einstein Medical Center at 215-456-7600. Tom had already given you the PA Medi helpline number, and I'll repeat that at 1-800-783-7067. So just to give you an overview. So thank you, and I certainly am here to answer more questions, and hopefully David Johnson, one of the program managers for our community partners, will be able to share more info. Thank you.
David, not last, but definitely with some positive. Greatly looking forward to hearing from you. It's your time, David Johnson.
Congressman, thank you for the opportunity to talk about Medicare this afternoon, and my thanks to my colleagues sharing all of this very helpful information about Medicare during this important annual open enrollment period time. My name is David Johnson. I serve as Carey Line Manager for CARY, the Center for Advocacy for the Rights and Interests of Elders. We are based in Philadelphia, Pennsylvania, and our organization's mission is to promote the well-being, rights, and autonomy of older adults through advocacy, education, and action. CARY offers a range of services to older adults, their caregivers, and their advocates, providing information and support across a wide span of older adult issues. But today wanted to focus on our provision of PA Medi counseling. I myself am one of our trained and certified PA Medi counselors. I serve alongside paid staff and an incredible group of volunteer counselors who, not just during the annual open enrollment period, but year-round, provide free, unbiased, and confidential Medicare information and counseling. We think of this program as one of the best kept secrets available to Medicare beneficiaries, though we'd rather we were not a secret. We offer counseling that can help educate beneficiaries who are turning 65 or are qualifying for Medicare for the first time in navigating the different letters, the different options, and helping individuals understand how they might think about coverage that could be best for them. Appreciate the mention of cost, coverage, and convenience. We will also provide assistance to seasoned Medicare beneficiaries alike during the open enrollment period who want to ensure that the plan selections that they are making for the following year or could make are going to be best for them. This program is heavily reliant upon incredible volunteer support. So yes, if you have questions about your Medicare benefits yourself, please do contact us at PA Medi, and we'll make sure you get to speak with a local counselor. And if you're interested in learning more about volunteer opportunities with this program as well, we would appreciate your consideration as well. Congressman, thank you again for the invitation to speak this afternoon.
Thank you, David. Really appreciate it. The person I'm going to introduce now has been with me a little while. He knows this. He's my staff communication person. So, Ben, I'll turn it over to you so Ben can introduce the question. Ben?
Yes, thank you, Congressman. Just to let everyone know, I know you heard some phone numbers and website addresses from our guest speakers. We are going to ask them to repeat those toward the end of the call. So you have time to get your pencil or pen and paper ready to write all that down. We will be asking them to repeat that information for you. And if you have a question, just remember to press *3 at any time. You still have time to do that. And with that said, we do have several questions waiting for the Congressman and our guest speakers. So we're going to go ahead and start putting some of your questions on the air here. Let me just check our list here really quick. Okay. One of our speakers, I believe, touched on this a little bit, but maybe you'll be able to give a little more detail. We have Kathy on the line, and she has a question about where to compare plans. Just a second here. Kathy, can you hear us?
Yes. Hi.
Okay, please go ahead and ask your question.
Oh, all right. Well, they already took it, but okay. My question was in terms of I have an Advantage plan. Is there some place that's easy and accessible to compare the plans, the Advantage plans, or the updates on my own plan? A lot of times it's pretty convoluted, and it's like reading tax forms. So I was just curious if there was something that, out of the things that you've been talking about that would help with that, because it's kind of overwhelming.
Yeah. Hi, Kathy. This is Sharon Graham with the Centers for Medicare and Medicaid Services. I'll start first with some of the online resources that we have here at Medicare, the federal agency that oversees the program. First, you mentioned about the updates to your own plan. Since you're enrolled in a Medicare Advantage plan, you should have received in the mail at the end of September, beginning of October, actually, so a little bit ago, what we call the annual notice of coverage. And the plan in that notice to all of its enrollees lists out what the changes are for the upcoming year. So hopefully you did receive that, and then it'll specifically address your particular plan. We have a great website, Medicare.gov, where you can do a plan compare. And you can even do a personal plan compare where you can include your medications down to their dosage level. So you'll be able to see very specifically. Yeah, exactly. So Medicare.gov, on the main page, you'll want to compare your health plans. And it'll ask you a couple of questions. And then we'll provide you the plans in your area that you can filter on a couple of different ways and choose up to 3 plans that you can compare side by side. And so if you're comfortable going on the computer, I'd recommend doing that. We have our 1-800-MEDICARE number where we have representatives who can also help do that. And then I'd like to send it over to Linda where she can talk about, and perhaps also Carrie too, we have local resources in the community if you want to meet with somebody one-on-one.
Can I ask you a question about that? You said you can compare up to 3 plans. If you put in your own Medicare Advantage plan, will the other 2 pop up as similar to compare it to, or do you have to pick one out of the 70 new plans?
If there's 70 new plans, but you would of course select your own plan first, and then you could select 2 other plans to compare those 3 side by side. Now, of course, you can go back and then put in 2 different. It won't give the resource to say, okay, this is the plan I'm on. This is what my advantages are. This is what I get. Are there any other plans similar to this that I can look at? I'm going to have to go through each one individually, right? So I think the answer to your question is yes. So you would have to select 3 plans with just a basic, let's say your main choice is about plan premium. So you'd want to filter on plan premium, and it would show you in order all the plans with the lowest premium first, and you could click yours plus 2 others, say, to compare side by side. And then it will compare all of the benefits and the out-of-pocket costs for each of those benefits for those 3 plans side by side.
Okay, and in terms of that, you said you were going to turn it over to someone local. Is there someone that you can talk to over the phone that can help advise you to a couple of more plans that are similar to the one you have?
Yeah. And Linda, this may be a chance for you. And I think.
Yeah, absolutely. Yes, thank you. So we do provide at the local level in Philadelphia some in-person counseling and clearly telephone counseling where we do have representatives that can help you with a plan comparison. My recommendation is if you should select to call us to make sure that you have a good list of your current medications so that that would help you in your selection. Clearly, your doctors, identifying which doctors and hospitals you clearly want to be affiliated with, and then, of course, information on your current plan. And then I'm going to hand it over again to David because he is doing more of the one-on-one individual counseling with individuals. He may have a few more tips for you.
Okay, thank you.
Yes, a lot of great recommendations so far, and would throw our endorsement behind the great Plan Finder tool on Medicare's website. This tool can work even more in your favor, I'd say, if you take the time to create your own Medicare.gov account using your Medicare number, things like your Part A enrollment date, fairly straightforward process. That will show you a snapshot of what your current enrollments are. It allows you to save your prescription drug information down to the dose and can include the pharmacies you'd be willing to go to get the most personalized results. Yes, you can speak with a person. The PA Medi programs at Carey and Einstein Medical Center, we're still taking appointments during this busy open enrollment season. You can speak with a counselor to either get some hands-on assistance, whether it's in person or over a Zoom call or a phone call. about available plans. We also can provide some technical troubleshooting. If you're feeling savvy to use the plan finder yourself and just want to make sure that you're using it the correct way, we can help with that as well. There are a lot of Advantage plans available.
Can you tell me
free right now.
what the phone number is for that, or the website for that, for the plan finder that you just mentioned? PA
Sure. For the plan finder. So I guess two things here. One, if you're looking for the plan finder that you and all Medicare beneficiaries can access themselves, that'll be on Medicare's official website, which is medicare.gov.
Okay.
And then for local PA Medi counseling, you can contact either our organization, CARI, which is 215-545-5728. This would be, generally speaking, for beneficiaries in Center City, Philadelphia, South Philadelphia, West Philadelphia, and then for the Einstein Medical Center, who also provide counseling, they can be reached at 215-456-7600 for Northwest, North Philadelphia, and Northeast. We work closely together. There's no wrong door. If you contact an agency and based on your zip code, your local program is at our colleagues at Einstein or vice versa, we will make a warm transfer and get you connected as easily as possible.
Okay, thank you very much. I appreciate your help.
You're welcome.
Okay, a lot of good information there. We're going to get on to our next question now. And I'm seeing multiple questions kind of along these lines. Some folks wondering about the future of Medicare. I'm going to put one of our callers on, and I know the Congressman wants to talk about this a little bit. Just a second here. A little technical difficulty. Hold on, please. I think that caller may have dropped off, but we do have, I know there were a couple of people who are asking about the future of Medicare with the new administration coming in. And Congressman, if you want to address that a little bit, and I don't know if any of our agency speakers would feel comfortable talking about that or not, but let's start with the Congressman, please.
Basically, the committee that I'm on the Ways and Means Committee. And I'm on the Social Security issue. So I share with you that this is my focus. So we will be dealing with oversight of this right there particularly. This is why we're having this town hall, to answer your questions and concerns. So you have my number, which you can always call, and Ben can quote our number if there's a particular issue about something. So Ben, you want to quote our number?
Sure. For the Congressman's office, that's 215-276-0340. I think, Congressman, you also wanted to address a little bit just what might lie ahead in terms of whether there's a fight over Medicare in Congress and that type of thing. You know, your commitment there.
I share with you, there's always a fight, but this is something you earned. It's not given to you. So the fact of the matter is, I made this a mission to work on this. And this is part of why I'm having this town hall discussion and taking all of your questions. And that's why I stressed in part of my office, you reaching out, and Ben gives that number. I want you to know that, because we are fighting to ensure that this is protected.
Okay, thank you, Congressman. Do any of our agency speakers want to talk a little bit about this question, or no?
This is Sharon Graham with the Centers for Medicare and Medicaid Services. I'll just say that the Congressman is correct that Medicare legislation is in the hands of Congress to consider for the future. We've had, since 1965, Medicare coverage has been available for people, and you would want to speak with your congressman about protecting that.
Okay, thank you.
And I'm pleased about protecting, because this is a problem. I'm pleased about protecting you.
Okay. So we have a couple folks asking about, I'll put one of them on here. Linda, people are asking this question both related to Medicaid and Medicare, just to be clear. And I think some of our speakers can address this. But, Linda, can you hear us?
Oh my God, this ain't me. I think they going to say Linda. They say something about Linda and Medicaid.
Yes, is this the first?
Oh, for me. Oh, okay.
Hello?
And what was your name?
Question about Medicaid? Medicare? Okay, we seem to have had some trouble with that, the line there. Sorry about that. We had a couple of callers asking, can a lien be put on your house, or can your house be taken after you pass away if you're on Medicare or Medicaid? So if some of our speakers could do that, please.
Hi, this is Sharon Graham. I'll start. Medicare is a health insurance program that's available to everyone who has paid into the Medicare Trust Fund. That would be your FICA taxes for 10 years, basically what we call 40 quarters of coverage. It is not means tested at all. It is not based on your income. So once you're eligible for Medicare and have gone to Social Security, as Rich Gaudiosi said, and applied and have received your Medicare card, you are covered and will remain covered by Medicare. As long as, of course, you're paying your Medicare Part B premium, which will be $185 a month in 2025. Now, Medicaid is a means-tested program, which our agency, along with the state of Pennsylvania primarily, do implement and oversee. And so that being a means-tested program, you do have to meet certain income requirements and do have to have certain limited resources in order to get Medicaid coverage. There is some ability for the states not necessarily to be able to possess your house, but to require that you spend down resources and other assets that you might have before Medicaid coverage kicks in for you. But again, that is Medicaid and not Medicare. I don't know if any other panelists would like to weigh in and add more information.
Okay. Thanks for clarifying that for everybody. That is very helpful. We have...
Hi, I'm sorry. This is David Johnson from Carey. If I could quick add something.
Sure, please do.
Great, thank you. This is a great question. At the PA Medi program and at Carey, we do hear questions from folks who are perhaps in need of some additional care or services at home and maybe looking into receiving some home and community-based services through the Medicaid program. I believe the question was, if you have Medicaid, can a lien be put on your house after you pass away? I suspect this is referring to the Medical Assistance Estate Recovery Program, by which if someone who is receiving certain medical assistance or Medicaid benefits passes away, the state Medicaid agency has a process by which they can try to get reimbursed for some of those services provided. There are many exceptions to this rule. This estate recovery process and can often be a barrier to someone seeking out services that they could benefit from. Have the telephone number here for the Estate Recovery Program hotline in Pennsylvania through the Department of Human Services at 1-800-528-3708. Or if you have questions about how this might affect or interact with your current benefits, including Medicare, you also can give us a call at Carey at 215-545-5728. While we're not attorneys and cannot offer legal advice, we can answer some general questions and point you in the right direction.
Hi, and David, I'd just like to add that, again, to reiterate that this is a state program through the Pennsylvania Medicaid program, and often because PCA completes the assessment process, often people assume that in some way Philadelphia Corporation for Aging is making a decision with regard to estate recovery, and that just is not the case. So often we complete an assessment. There are specific criteria and eligibility criteria that must be met in order to receive certain services. And again, it is not the PCA's decision. We, of course, would educate and inform you, but we in no way try to take possession of homes or in any way collect funds with regard to that. It is definitely, as David said, a Pennsylvania estate recovery program. So again, we're just educating and ensuring that you understand. Thank you.
Okay, and to kind of recap for everybody, if you're on Medicare only, then this stuff would not apply, correct?
Correct.
Okay. All right. Well, thank you to all of our speakers for that one. I want to move on to our next question. We have somebody asking about, this probably will affect quite a few of our listeners, how veterans' benefits can interact with these programs. Sarah has a question. And Sarah, can you hear us?
Yes.
Okay, please go ahead with your.
I wanted to say that I've always, since for the past 12 years, I've been on a fixed income, and my husband has passed away last year, and this year I was able to collect benefits from the VA. Will that affect my Medicare and Medicaid?
Hi, Sarah. This is Sharon Graham with the Centers for Medicare and Medicaid Services. And you will still always have your Medicare. You have your red, white, and blue Medicare card, or perhaps you've enrolled in a Medicare Advantage plan. So you'll always have access to Medicare. What's important to know is that if you go to the VA for healthcare services, it's the VA that will pay for those services and not Medicare. And the VA has a different set of benefits and criteria that they offer at their facilities. But when you do go there, they will cover your services in the facility or with their doctors. But if you go to the community and use your red, white, and blue Medicare card or your Medicare Advantage card, then Medicare will pay. So basically you have access to both sets of healthcare services.
Okay. But I haven't applied for their services. I just have, my regular Medicare and Medicaid Advantage plan.
Okay. Yep. And you do still have that.
I didn't want to fix it. If it's not broke, I didn't want to fix it.
Yeah, that's right. You'll always have your Medicare. Now you just have the option of getting services through the Veterans Administration too. It won't remove or reduce your Medicare benefits, having those VA benefits.
Okay, because I just went to the doctor's office yesterday for my eyes, and I didn't have a copay at all, but I just got a bill for $269, and I have informed Medicaid of the changes, but I haven't even gotten an answer yet, like from them.
So I think I heard you say, Sarah, that you have a Medicare Advantage plan, and so hopefully that is a service that's covered by the Medicare Advantage plan. I wouldn't know without having to look up the plan. But if you did get a bill from the optometrist, then you'll want to make sure that optometrist bills your Medicare Advantage plan and doesn't send you the bill.
Right, because when I had gotten a $20 bill from them before, they didn't understand why, because they know I don't have any copay. Because I also have Keystone First.
Right. Yeah. So you'll want to, I would suggest calling the plan to work that out, making sure first that your doctor sent the bill to the right place. And then if you still do get billed for any additional, like that $20 that you mentioned, to talk with the plan about that if you have a zero copay.
Right. Okay.
It almost benefit from talking to one of the agencies that will repeat them to contact info at the end of the call to kind of help sort out what might work best for her in terms of maybe getting VA benefits instead or something.
Yes,
So,
and
I
I
think
also,
Yep.
I'd like to add that potentially, since you indicated that you are a lower income, or that you're on a fixed income, and of course don't disclose that, but just to understand that Medicare does have some initiatives and programs that may be able to help you with the cost of your Medicare Part B premium. So there is a Medicare savings plan, and there's also a low-income subsidy plan that in some instances can help with your prescription drug coverage. So, again, in addition to that, it might be worth it to reach out to our programs if you have questions, and they can give you that, as David said, individual and personalized counseling.
Okay, what I was saying was I was considered low income. When my husband passed, I was getting spousal support, but when he passed, that stopped. So then when I got my extra income, is double. So I had just stopped paying the Medicare Part B. I've been paying that since 2010. That stopped when the spousal support stopped, and they started paying it for me. But I don't know that that's going to change now.
Okay. What we may want to suggest here is for some specific issues like this, and if folks have them, is that you can contact the congressman's office or stay on the line at the end of the call and leave a voicemail for the congressman's office, and we may be able to help you sort this out. That number for everybody is 215-276-0340, and that can be a way that we can help you kind of navigate some of these things. So we do need to move on to our next question.
Thank you.
But yes, thank you. Okay, so we have time for like one or two more questions. We are coming toward the end of the event, and I know we will be asking, again, all of our speakers to repeat the contact information, both the phone numbers and website addresses, in just a couple minutes here. But we do have time for one more question, and I think this will apply to quite a few people. Debbie has a question about how you can search for some of this information. So let me go ahead and put her on here. Debbie, can you hear us?
I can. Congressman, I just
Okay.
wanted, when I was looking around for next year for Medicare Advantage programs, everyone has always asked me about my zip code. Does that mean that each insurance company is limited in a zip code of how many Advantage plans they can offer? Because I was wondering why they were asking about my zip code.
Hi, Debbie. It's Sharon Graham with the Centers for Medicare and Medicaid Services. And yes, Medicare Advantage plans do offer their services in specific geographic areas. Sometimes those are large areas, like the entire state of Pennsylvania, and sometimes they can be as small as a county. But what drives that primarily is the plan's business decision on where they want to do business, because they are private insurance companies that we contract with. But also, and more importantly, it's about where they have strong provider networks in place. One of the key things to know about Medicare Advantage plans is that they have provider networks in place that they contract with. So while about 98% of all providers out there work with Medicare and accept Medicare, not every provider accepts every Medicare Advantage plan. And that's why it's so important that if you're considering or are in a Medicare Advantage plan, you know what their network of doctors and hospitals and labs and things like that are. Because in some cases, in a true HMO, health maintenance organization, you can only go out of network if you have an emergency or an urgent need. Every other type of health service, you have to stay within that network of contracted doctors. Now, we do have many plans now that allow you the opportunity to go out of network and go to a non-contracted provider, but in most of those cases, you're going to pay more for the privilege to do that. So it's very important to know with Medicare Advantage who's in network in that geographic area.
Because I, in particular, was looking for a preferred provider organization or PPO, and even with that, they were asking me about my zip code and information about general information about my provider, hospital, those kinds of things, and the medications that I'm on.
Yeah, and because even in a PPO, there's a contracted network of doctors, and if you were at Medicare.gov, it would show you both the price of being an in-network using a contracted doctor and also the price of being out of network. So even in a PPO, the contracted network applies and it affects your cost sharing.
Thank you so much for your help.
Sure, you're welcome.
Okay, thank you. We do have time for one more question here, and then we'll be going back to our guest speakers. So hang on the line, everybody, to make sure you can write down any phone numbers or website addresses at the end here after this last question. Let's see, it's a question about Medicare Part A, and it's from Roslyn. I hope I'm pronouncing your first name correctly.
Yes, you are.
Can you hear us?
Yes,
Oh,
I can.
wonderful.
Can you hear me? Yeah. Mm-hmm.
Yes, ask your question, please.
My question was, when I first applied for Medicare, I hadn't applied for Social Security yet. So I had Parts A and B, and I was paying out of pocket. When a few years later, I applied for Social Security, checked the box saying, take out the Medicare payments out of my Social Security. Well, that didn't happen. Eventually, I lost Part B. What I want to know is, how do I get Part B back? I still have Part A.
Well, hi, Roslyn. I think this will be a joint question. Is that Rich? Were you about to log in to weigh in first, Rich?
Yeah. This is Rich from Social Security. So first thing I would say, ma'am, is we need to figure out what exactly happened here. So you need to get with us at Social Security at your local office, and we'll look into the sequence, the order of things that happen, because when someone receives Social Security cash benefits and they have Medicare B, it's supposed to automatically be taken out of their Social Security check.
Yeah, so, that's what I thought too. But I didn't apply for Social Security and Medicare at the same time.
No, I understand, but regardless of when you came onto cash benefits, that should have happened then. That's why I'm saying we need to look into the sequence of things and figure that out. So that has to be untangled. It basically sounds wrong to me.
Okay. Yeah, it feels wrong to me. Yes, thank you.
Oh no, yeah.
So this can't be something like is unraveled over the phone. I'd actually have to go to.
Well, I really think the best thing for me, ma'am, is to be able to sit down in the office and talk to somebody. Let them call up your record, and they can, because there's probably going to be a series of questions and things. It's not that easy to just kind of unravel it over the phone, I don't think.
Okay, all right, that sounds good. Then I will do that. Thank you very much.
Okay, hi, ma'am. Be well.
No, you too.
Okay. Did you want to go ahead and give your contact information for your office now before we get to the rest of the speakers doing that in turn? Just since we had that question there.
For Social Security?
Yeah, I think that sounds like.
Yeah. Okay. Oh, yeah. So our national 800 number is 1-800-772-1213. 1-800-772-1213. We also have a lot of online services. You can do certain things based on, you might need a Medicare card replacement. You can do that online. We also have, and you call our 800 number, there's automated services that you can request whatever you might need. So sometimes people need a letter of how much they receive in benefits, or again, if you need a Medicare card to be replaced, we can do that. So, but 1-800-772-1213. And our local offices are open weekdays from 9 a.m. to 4 p.m.
Okay, thank you. At this time, I'm going to turn it back to Congressman Evans. And Congressman, when you go through the list, of course, we just heard from Richard Gaudiosi, so you can skip to our CMS folks when you get to that portion.
I'd like to thank you, Ben, and thank Richard. I'd like to thank all our guests. And I like to thank the people. It's important because the people need the guests and vice versa. So now what I like to do is ask each person to take their time to do the phone number and the website. So Sharon, I go to you, and Sharon, you could take from there, Sharon.
Sure thing, Congressman. Thank you. I really appreciate the time to speak with everybody today on the phone. For Medicare, for your federal resources for Medicare, you have a few. As I mentioned, everybody should have received your Medicare and You handbook in the mail at the end of September. If you did not, please call our Medicare number and ask for a book to be mailed to you, a Medicare and You handbook. And that number is 1-800-MEDICARE, MEDICARE, so very easy to remember. Or you can also go to our website, which is medicare.gov. And at medicare.gov, that's where you can do a really great plan comparison for not only the Medicare Advantage plans that we spoke about today, but also prescription drug plans that you may consider purchasing if you choose to keep original Medicare. How about if I turn it over to Linda next?
Yes, correct.
Hi. For local program information, again, we're geared to help you navigate this system. And so for local program information for PA Medi, you would contact either Carrie at 215-545-5728 or Einstein Medical Center at 215-456-7600. Of course, you may contact the PCA helpline at 215-765-9040. And there is also the state PA Medi helpline at 1-800-783-7067. Thank you.
Does Thomas have anything to add?
I would just add, Congressman, that people who need help in paying for their medications should inquire of PACE as to their eligibility. And that number is 800-225-7223. PACE currently has a lot of people on Medicare, Part D, and most of them get a lot of help by being in PACE. We pick up their premiums, we get them in a low-income subsidy, and we wrap around co-insurances and off-formulary drugs. So it can be a big help if you're eligible.
So I'll go to Dave Johnson next. Dave from Carrier.
Thank you again, Congressman, and thank you to Linda Pickett for sharing Carrie's telephone number, which is 215-545-5728. You can also visit our website, which is Carrie, CARIE.org. Last thing I will plug is that we're talking about the PA Medi program, which is available here locally in Philadelphia. Please tell your friends and family about this Medicare counseling. It is available nationwide as what's called a State Health Insurance Assistance Program, or SHIP. Each state may have a different name for it, but it is the same service providing free and unbiased Medicare information and counseling. Your friends, your family living in other states can contact either Medicare at 1-800-MEDICARE or their local area agency on aging for some free personalized help for themselves.
Does Monique Scott have anything to add?
No, Sharon already covered it. Thank you so much.
Okay, thank you, Ben. And I now want to thank all of the people. And I'm going to ask Ben, and this is very important, Ben, to make sure people get our number, website, any information, and contacting me directly. So you want to go through that, Ben?
Certainly, Congressman. Thank you. If you're looking for the Congressman's website, that is evans.house.gov, G-O-V. If you're looking for the Congressman on social media, there are 5 different places you can follow his updates if you're looking for that. His name on all 5 of them is simply Rep. Dwight Evans. That's on Facebook, Twitter, Instagram, Threads, and the new Blue Sky platform. So you can find information from the Congressman's office there as well. And then, of course, a lot of folks like to use the phone like we're doing today. The main phone number for Congressman Evans' office is 215-545-5728. 276-0340. Congressman, did you want to mention the voicemail, or should I?
You should do it.
Okay. So anybody, obviously we could not get to everyone's questions, but we appreciate that you took the time to be on the call. So you have the option to just stay on the line at the end here and leave a voicemail for the Congressman's office so that we can try to get back to you about your questions. And that's it.
And I want to stress to each of you who have called, I want to thank you, but I want you to understand, if you was not able, that we worked for you. And it's important to understand that we want to ensure that you have complete access, as Ben will give them complete access to how to get, because we want to make sure you understand that because of you, and I thank you for doing it. Ben, anything else?
Nope, just if somebody has a question still, they should hang on the line to leave a voicemail. That's it. Thank you.